Hi everyone, welcome to my YouTube video. I have decided to make some videos on my journey through double jaw surgery, and I have watched quite a few videos on this topic since I'm going into the surgery, and they've all been really helpful. So I decided to take some videos myself just so I can put some of that information out there for other people to look at, and also just for myself to look back on my journey and see kind of my before and after in the whole process with everything going through it. It is important to note that everyone's journey is really, really different. I've watched quite a few videos, like I said, and everyone has a different kind of things that they go through. But in general, what I've experienced is most people are very happy with their results and say that they would do the surgery again. So it seems to be worth it, and I'm hoping it's worth it because it is quite the ordeal. It's quite the process. The healing is really intense. You can't eat. Your face is really swollen. Your appearance changes quite a bit, or it can. So there's a lot to go through in the coming weeks. So I'm honestly just kind of looking forward to getting past it and getting through it and being on my healing journey. Right now, like in the weeks before, the anxiety is killing me. I just want it to be over with. But I thought I'd tell you a little bit about why I'm getting double jaw surgery, so that you know. I have a class 2 underbite, which means that my lower jaw is pushed back. And this I've had obviously my whole life, but it prevents my teeth from my upper jaw, my lower jaw is too far back. And so obviously I have braces on right now. Sorry if my ring light is kind of bright. And before I had braces, my upper teeth were tilted back a little bit to meet my lower jaw. But now that I've gotten that corrected, my front teeth sit so far in front of my lower teeth that it's really hard to use my incisors, and it's harder to chew food. So that's kind of the big issue with that. The other issue I have is I have difficulty breathing. And that's primarily through my nose, and I do have a deviated septum. That's another issue to solve down the road. But another issue I have with breathing through my nose is that my upper jaw is squeezed tight and narrow. It should be a little bit wider. And because it's kind of squeezed in tight, the roof of my mouth kind of sits up higher into my nasal passageway. So not only do I have a pretty bad deviated septum, but I also have pressure coming up from the bottom, making it really hard. It's always been hard for me to breathe through my nose. I can't get a full breath. And when I was at the doctor, I can't remember, he put his finger or something down my nose to kind of open up the airway in one of my nostrils, and he's like, now breathe. And so I breathed, and I was like, what? This is how you're supposed to breathe? He's like, yeah, you have really restricted breathing through your nose. And so, yeah, it's not good. I've had it, so the past couple of years I've had some really bad anxiety about not being able to breathe. Just constantly, especially I work out pretty hard. If I do a HIIT workout, pretty intense workout, I will have a panic attack at the gym because I just feel like I can't breathe. And just in the past few years, I constantly get anxiety about not being able to breathe. And so the other issue is not only do I have the issue not being able to breathe through my upper nose, but because my lower jaw is pushed back, and I'll kind of show you my side profile so you can see. And I can't see because the camera isn't ahead of me, so hopefully you can tell here. But my lower jaw is pushed back. It should be out here. but it's back here, if you can see that. So what that does is when your lower jaw is pushed back, your tongue doesn't have as much room to sit forward. I'm sorry, I'm clearing my voice a lot. Just realized that. Your tongue sits further back into your mouth and it closes off your airway. So for a while, whenever I work out really hard at the gym, I find myself doing this when I would like be breathing heavy, like just to breathe. And that was the only way I felt like I could like really breathe through my mouth, is if I just jet up my jaw and just like, so that's sometimes when I'm freaking out about not being able to breathe, that's like the only thing I can do that will like calm me down. Otherwise, like I will full on freak out. But you know, not a lot of people, I don't think they realize how bad my lower jaw is. And it's not a severe case, like some people I've seen out there with class 2 bites, but it is worse than people realize because I have a protruding chin, which again, I'll show you my profile. You can kind of see my chin actually sticks out and it actually sits where it should be. So my chin is protruding. You can see it kind of sticks out. So my chin, having a protruding chin, actually disguises the fact that how far my lower jaw is receding. If my chin was flat or my chin was normal, I think a lot more people would realize that how bad my lower jaw is. So I think some people are kind of like, really, you need that? I'm like, yeah, I don't think you realize how bad it is. It's hard for me to breathe, and I need to get it done. So yeah, the main reason I want to get it done is for breathing, honestly. Eating, chewing, swallowing. For years, my sister has made fun of me because I swallow my food really hard, and especially water. It's like I always have to gulp. Like every time I swallow, it's like, it's a big gulp. I can't just swallow it like silently. Like I always have to gulp down my water really hard. So there's that too. But of course it's going to change my appearance a little bit as well. When you have a receding lower jaw, you do tend to get these marionette lines right here, which I don't really have too bad. I know when I get older, they'll get worse, though, if I don't get it done. Basically, what's going to happen with my surgery is, so I have to get the upper and lower jaw done, even though my lower jaw is really the main issue. Sorry, my cat is playing with my computer. Even though my lower jaw is the main issue, they can't just move my lower jaw. So they have to move my upper jaw with it because my upper jaw sits kind of tilted down a little bit. So they can't move my lower jaw. They have to tilt my upper jaw, kind of move it out and tilt it up, and then they can move my lower jaw forward. So they can't just move one without moving the other because then I won't have the correct bite. When I try to chew food. And I'm going to turn down my ring light because it keeps freaking out. So hopefully that's better. Okay, so yeah, so that's why I have to get double jaw surgery. I can't just do just the lower jaw. My bite will not fit if they do the lower jaw. And it's the best way that it can fit together. And it's really the only way they can move it forward. They can't move it forward the way it is because my upper jaw is kind of tilting down, and it's not, my upper jaw is kind of pushed back a little bit too from where it should be. So they have to move both of them. And they'll also be kind of cutting. So they'll be cutting from here. There's like a nasal opening here to somewhere back here. So they cut there, and then they're going to cut kind of in between my teeth, I think right here. and they kind of splay it out a little, and so it'll be a little bit wider. And then on my lower jaw, they're gonna cut. Sorry, I'm trying to figure out which way I'm looking. They're gonna cut back, kind of behind my molar here, and they cut it kind of at an angle so that they slide it out right here to kind of meet it, and so that will, then they'll put them together, I guess. The other thing they'll be doing, like I said, I have a protruding chin. They're going to be doing a reverse genioplasty because once they get my jaw out to where it needs to be, my chin's going to be, I mean, if it's prominent now, it's going to be really prominent when my jaw is where it's supposed to be. It's going to look a little, you know, and that part of it is cosmetic, but they're going to have to move my chin back a little bit so that it's not popping out so far once I get my jaw up to the place. So they will be doing, it's called a reverse sliding genioplasty. So they cut your chin kind of like this way, the bone, and then they slide it like backwards a little bit. And I told him I don't want him to do too much, like just a little bit of sliding, just so it's not too big, because I like having a little bit of a chin. Like I don't want a flat chin. I just don't want it to be popping out quite so much once my jaw is where it should be on my face. So yeah, you know, this, like I said, this surgery is a big deal. It's really, it's got its risks too, and the biggest risk with this type of surgery is the possibility of permanent nerve damage, and that's the nerve that comes down along here primarily. He said there's about 20% chance that I'll have permanent nerve damage. 20%. That's kind of a lot. But he did say that my nerve, the way it runs is like closer to my tongue. So he said that just where it's located there's a lower risk of that happening even still. So I'm crossing my fingers. But there's definitely real risks involved in this surgery, you know, not just the intense recovery, but, you know, definitely nerve damage could happen. You could not be happy with your results. You know, I'm sure there's issue with the hardware, so there's going to be hardware in my face permanently for the rest of my life. I think I'm going to have a bracket here, or 2 brackets here. I think 2 brackets here. Obviously 2 brackets here, and then I'm going to have 1 for my chin. So I'm going to have metal in my face for the rest of my life. So I'm sure there's risks that come along with that as well, you know, long-term, short-term pain and stuff like that. And I do, from watching the videos online, it does seem like most people have swelling for the first, pretty much the whole first year. It takes like a full year for your swelling to go down pretty much completely, and I've even heard some people who say like 2 years in is when they think that like all the residual swelling like went away. So it's a long battle. It's going to be like a really long recovery, but again, every person I've seen online, all my doctors, they've said, you know, I'm a really good candidate for the surgery and it's going to be so worth it in the end. So I really hope it will be. Hoping I can look back on this video and say, yeah, it was worth it. You know, I'm going to try to keep doing more videos throughout this. My plan is right now, I want to do 1 more video before the surgery, maybe just talking about kind of my surgery supplies, essentials, maybe more of an update on stuff going on with the surgery. I plan to document it the first week, maybe on a daily basis. We'll see. Probably end up being more of a weekly video type of thing, and then eventually maybe like a monthly thing. I don't do a lot of social media. I'm not a big social media person, so if I keep up with this, it'll be a surprise to us all. But thank you so much for watching my video, and please keep watching my videos. If you want to subscribe, you can do that. Hit the notification bell, and we'll see how this journey goes. Thanks, guys.